In this page or PowerPoint presentation, we are going to focus about the admission and also psychiatric mental health nursing educate our patient. So voluntary admission, the client who look for admission for the care. The voluntary client is free to sign out of hospital with primary healthcare provider and notification and prescription. Voluntary client, again, his or her will is termed for false imprisonment. The civil rights are retained fully by the client. So what are the patient rights? We have to follow this one as well, right? So next here, what are the civil rights retained fully by the client? So when we deal with the patient, it is important to keep the patient right in our mind. So they said the right to accessible healthcare, right to coordination and community healthcare, right to courteous or individual healthcare, right to information about qualification, names, and title of personnel, right to refuse observation by individuals not directly involved in care, right to privacy and confidentiality, right to informed consent, and right to the treatment and to reinforce treatment, right to treatment in the least restrictive setting, and right not to be subjected to unnecessary restraint. So when we go for psychiatry mental health nursing, we have to keep in mind what are the patient rights. Also patient confidentialities. It is called HIPAA, HIPAA. So HIPAA law protect a patient right to privacy. Patient information may not be disclosed to anyone that is not directly involved in the care of patient without patient's consent. But keep it note, sometimes some are exceptional. So if the nurse is determined the patient poses a serious threat to another person, the nurse has to protect the third party. Or what are the rights to refuse the treatment? So patients have the right to refuse medication or other therapies, even if they were voluntarily admitted, but except in an emergencies. What are the rights? So right to least restrictive environment like restraint or circulation should only be used as a last resort and for shortest duration of time. So this is basically civil right for the patient. Continue. Right to information about diagnosis, prognosis, and treatment. Right to information on the charge of service. Right to communicate with the people outside the hospital through written, telephone, and personal visit. Right to keep clothing and personal effect. Right to be employed. Right to religious freedom. Right to execute the wills and right to retain the licenses, preference, and permit established by the law. So what are the right of confidentiality? We already talked. The client has a right to confidentiality regarding his or her medical information, the Health Insurance Portability and Accountability Act, 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 or it's called HIPAA. Client confidentiality with regard to release the electronic transmission of data. I say HIPAA law protect the patient right to privacy. Also, patient information may not be disclosed to anyone that is not directly involved in the patient care of the patient without patient consent. Information sometime must be released in life-threatening situation without patient consent. We call exception, like if the nurse determine the patient's poses a serious threat to another person, the nurse has to protect the third party, right? So in the events of specific threat against the identified individual, that healthcare professional has a legal obligation, except in emergency situation, the client information can be released only with the client informed consent, which specify the information that can be released and the time frame for which the release is valid. Let me talk about more about admission. So involuntary admission. So first one was voluntary admission. Now going to talk involuntary admission, and also we will talk about the emergency admission. So voluntary admission, as I told you, patient request admission and may sign out at any time. Keep it in mind, admission may be changed to involuntary if the patient meet criteria established by state law. In case of involuntary admission, admission without consent if the patient poses a risk to self or others, or is gravely disabled, means unable to care for basic personal needs. Also require a certain number of physicians to confirm justification for commitment. So involuntary admission may be necessary when a person is mentally ill, is a danger to self or others, or in need of psychiatric treatment or physical care. Involuntary admission occurs when a client is admitted or detained involuntarily for mental health treatment because of actual or any danger to self or others. The client who is admitted involuntarily retains his or her right for informed consent, right? So informed consent means the patient is voluntary decision to undergo a procedure or intervention. So basically provide a role to explain the nature of the procedure and risks and benefit of the process or procedure. Alternative to the procedure, risks and benefit of alternative procedure, also access the patient understanding of information. So as a nurse, what is our role? So the healthcare provider rules sign consent from a witness and confirm the patient received and understand above informations and ensure patient is competent and gave the consent voluntary. So this is talking about the as usual patient who is healthy, there are no mental issues. So involuntary admission occurs when client is admitted or we told involuntary or mental ill treatment. The client who is admitted involuntary or the client retain the right of refuse treatment, including medical, unless separate or specific treatment order is obtained from the court. What next? The client loses the right to refuse the treatment when the client poses an immediate danger to self or others, requiring immediate action by healthcare concern or team. The order form of judge is required for involuntary admission, except in case of an emergency, which allow the time to obtain the necessary order from a judge. In the cases of all involuntary admission, the legal counsel must be provided for the client. The court hearing is held by a judge within a specified time for the client admitted involuntarily. A specific time of period vary by the state, right? So let me tell you, involuntary admission, as I told you, admission without consent if the patient poses risks to self or others, right? So in most case states, the client can institute a court hearing to look for any kind of judicial discharge. The court of hearing that determine the meat is whether the client may be released from hospital or patient supposed to need further treatment or evaluation or committed to the mental health facility for under terminated time period. The client has a right to treatment in the least restrictive treatment environment. If the treatment objectives can be achieved, for example, by court-ordered treatment to end outpatient facilities as opposed to the inpatient facility, the client has the right to be treated in outpatient setting. What next? Involuntary admission. The client is considered legally competent unless he or she has been declared incompetence through the legal hearing separate from involuntary commitment early. So in the course of providing nursing care and caring for medical prescription, if the nurse believes that the client lacks of competency to make informed decision, action should be initiated to determine if the legal guardian needs to be appointed by the court. So now the type of mental health admission and discharge. So one more admission is called emergency admission. Before to go to the release or discharge. So I said emergency admission means patient is in emergency or any kind of imminent threat to self or others, or require the court hearing to determine if the patient may be discharged or involuntary admission is required. So next go, the release from hospital, right? So they said release from hospital, a client may be released involuntary, again the medical advice, or with condition. It's called conditional release. The client who should voluntary admission has the right to release upon request. And voluntary release in absence of an act of self-harm or danger to others. A voluntary client should never be retained. If a voluntary client wishes to be discharged from treatment but is considered potential dangers to self or others, the primary healthcare provider can prescribe the client to be retained while the legal proceeding for involuntary status. So my question is here, in case of psychiatric admission, the law vary by state to state. It is very important to keep in mind. In voluntary release, some states provide for conditional release of involuntarily hospitalized client. And this enable the trained healthcare provider to prescribe continued treatment. Also, conditional release usually involve outpatient treatment for a specific period to determine the client compliance with medication protocol. Ability to meet basic needs and ability to reintegrate into the community. An involuntary client also is released conditionally, may be reinstitutionalized while the commitment is still in effect without recommended for formal admission procedure. And what are the discharge plan and follow-up care? And also it is important patient education, right? So first of all, here the discharge is terminated to the client, and also this unconditional release may be prescribed by psychiatrist, by court, or administrations for involuntarily admitted client. In most cases, state, the client may institute a court hearing. Also, discharge planning or follow-up care is important for continued well-being of client with a mental health disorder. Aftercare case manager are used to facilitate the client adaptation back into communities and provide early referral if the treatment plan is not successful. So whatever it is, as a nurses, it is important keep documentation. So all elements of voluntary, involuntary, or emergency admission or commitment, we have to keep in documentation, right? So also it must be documented on a form, or in case of special care in the patient's medical record, we have to keep it